It has always been the hope that when we move down here, moving into the community, that we'd be more a part of the community. Learning medicine is not simply about physiology and pathology. If we don't understand the social determinants of health, all the things that go into our community that influence care, then we can never really truly take care of our patients.
I grew up always looking for ways to be of service in the community, and I first heard of UB Heals on the Jacob School website when I was getting ready to apply to medical school.
I was drawn to UB Heals because it was very clear that it represented a way to combine my interests in service learning, in addiction medicine, and in mental health.
I first heard about UB Heals from my clinical practice leader. He spoke so highly of it. He told us he had been deeply moved by his first experience at the foot clinic. And after that point, he said to himself, if medical students are washing people's feet, I can't not be involved. So that was my first introduction to UB Heals.
UB Heals and the overall street medicine program are an amazing way to give students a different perspective. It's about going into the community to learn from individuals what they need from us. The community offers incredible opportunities for learning. But we cannot take from the community. We have to realize that this community, our community, is actually one of the poorest in New York State, with some of the worst health outcomes.
I wasn't sure what to expect going out on street rounds with the team. I knew that you go out and examine patients and provide care, but I still didn't really know what that meant out on the street.
I remember the first time we went out. We saw this kid, must have been 17 or 18, sleeping under the bridge, going down by the inner harbor. And we just went down there by the corner and this little face popped out from under the blanket. I almost started crying right away. I mean, it was like, this can't be possible. No, that's not every day, but every day you learn something from somebody.
For me, the biggest surprise out on rounds was that some of the most significant interactions I've had are instances where you talk for like 15 to 20 minutes with an individual, and then all of a sudden they open up about something. It's not necessarily something medical, it could be social or psychological, but we can connect them with other resources to get the assistance that they need, and we offer that connection for them.
UB shows up, and the community is generally trusting by this point, and people who didn't have anyone to talk to could talk to the students. There's people who come week after week to get their blood pressure checked, and I don't think they need their blood pressure checked. So it's just they're regulars. They come in and they just for that interaction that somebody cares, and that we have some hope.
I was ready to get out there and bandage up wounds on the street, which we do, but some of the most moving interactions that we have are when we're able to link patients with other kinds of care. And we have these incredible partners like Jeanette and Carrie Ann who help us do this in the community.
My name's Jeanette Evans. I'm a nurse practitioner at Neighborhood Health Center. I lead the Healthcare for the Homeless program. We've been working with UB Heals for about 5 years. We go out on street rounds with them once a week. I've noticed that the med students really get a chance to get to know people on a level that they wouldn't have the opportunity to in the hospital.
The trust is just not there for a lot of the individuals who we work with, and on our website it says our goal is to bridge the gap between individuals experiencing homelessness and the local healthcare system, and that's really what we do. We become a point of contact for them.
Many of them have been alienated to the point they don't come to the medical community. They don't come to us. I think that's how street rounds were born. We'll go to those who don't have any trust in the medical field.
It's impressive to see physicians come out and be so engaged. I see examples of the physician I want to be. They make time to come out and work in the community and teach students.
Medical school sometimes gets the reputation for being very competitive and cutthroat. But what you see here instead are deep connections across multiple boundaries and hierarchies. And you see passion for medicine. Dr. Lucan isn't just sending his residents out. He also comes himself on street rounds. It's important for the faculty to introduce the residents to this work, yes, but it's also really important to see the faculty themselves out there.
So the big thing we've learned from our community partners and previous members of UB Heals is the importance of establishing consistency and constancy. There's a cycle of trust in medicine, and it has to be built. We show up, we're there every Tuesday and Thursday, people can rely on us. We'll be there with the supplies to help and with good attitudes and open ears. This isn't a one-year thing that you just do and never come back to. The experience becomes a part of you and a part of the physician that you will become.